Precision diagnostics and precision care are not two separate steps. They are a single continuous system, and treating them otherwise is costing health plans time, money, and patient outcomes. Dr. Bill Kerr, co-founder and CEO of Avalon Healthcare Services, has spent over a decade building the infrastructure to close that gap. With a career spanning chief medical officer roles at WellCare Health Plans and Blue Cross Blue Shield of Florida, Bill brings rare fluency across clinical science, health plan economics, and operational complexity. Through Avalon's Diagnostic Insights platform, his team is ensuring the right test reaches the right patient at the right time, driving smarter decisions and reducing costly waste across millions of members nationwide. Join us to discover how precision diagnostics are reshaping the future of value-based care. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Dr. Kerr. A warm welcome to our podcast. I'm thrilled to have you on today.
Mike, thank you for the time. Thanks for having me.
Well, given your extensive experience leading medical strategy across some of the most recognized names in healthcare, including WellCare Health Plans, Blue Cross Blue Shield of Florida, and CareCentrix, as well as your passion for transforming how diagnostic testing is managed to deliver smarter, more precise care, I'm excited to have this timely conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn in order to further the conversations occurring on this podcast. All right, Bill, it's almost time for our community to learn how you and the Avalon Healthcare Solutions team are pioneering the integration of precision diagnostics and precision care as a single, continuous system that transforms outcomes for health plans and the millions of members that they serve. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Mike, I think I'd give two pieces of advice. First, stay true to the science. I think you stay true to the science, it's a great place to go as your true north. And second, follow the money. In healthcare, that will explain a lot. So stay true to the science, follow the money.
Well, I'm not going to weigh in on my opinions about some folks not staying true to the science in this current day and age, but that's a whole nother aside, and I'm going to leave my opinions out of it. But that is a true statement. I love it. And it is more important than that, of course, than you mentioned too, follow the money, right? This is a multi-sided buying ecosystem that is healthcare. Very, very complex. A lot of different avenues in regards to following that money. And you're right. We've seen so many entrepreneurs, so many startups build a product and thinking that there's a home for it versus figuring out what are the payment mechanisms, what are the gateways to actually build a viable business. And so, Bill, that is extremely important. Let's stay on that topic for just a moment, especially with a lot of the aspiring entrepreneurs that are tuning into the podcast to learn from a veteran like yourself. How important was that at the gates regarding the build of Avalon? We're going to discuss Avalon on the other side more in detail after the commercial break. But just at a high level, how important was that out the jump, out the gates when you started building Avalon to follow that money? How important was that to now think back, 13 plus years in for the success you're having? How important was that single piece of advice?
Absolutely critical. I mean, those are the two axioms we've used since day one. Stay true to the science, never give it away, but follow the money because it's going to tell you a lot. And Mike, I would take it a step further and say, in healthcare, I think to be an entrepreneur, the hardest thing is not to come up with the idea, it's to execute it in this complex environment. There's so many entrenched players. There's regulatory constraints. Navigating all of that is much harder than coming up with the idea, I think, in healthcare. And the money sort of helps you follow some of those incentives, quite frankly.
Very well said, Bill. It is incredibly fraught with regulation, as it should be, right? I mean, this is an industry that's touching human lives, right? So as it should be. But you're right. The folks that find success know how to and understand the pathways, the mechanisms, following that regulation, following the money. Those are the ones that succeed. You can have the idea, but if you're not in the trenches, not deeply understanding how all of those mechanisms work, it can be a very tough sled for sure. Obviously, you guys have figured it out now, almost 13 years in at Avalon. We have a lot to discuss. Obviously, you were a physician as well. have that background. So we're going to talk about how this all came to be, where you guys are today, where you're heading tomorrow, of course, how we can help you out. We're going to discuss all of that and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we're back with Dr. Bill Kerr, founder and CEO of Avalon Healthcare Solutions. Bill, thank you so much. Follow the science, follow the money, incredibly important, especially in this highly regulated environment that is healthcare. We're going to discuss some of that and more in regards to you and the team founding the company now almost 13 years in. It's been around. Congratulations in and of itself. That's a huge feat for any new company in healthcare to survive 10 plus years. Incredible. Can't wait to hear how it all came together in the first place. Then got to discuss where are things today. You know as well as I do, Bill, things are moving rapidly within healthcare, innovation, technology, how we're thinking about delivering care, not only today, but really into the future. So we're going to discuss a little future state as well. What are you seeing on the horizon that we need to be mindful of? And of course, we can't get you out of here until we figure out a way or two to help you and the team out. But Bill, let's rewind the clock a bit. Take us behind the scenes, if you will. How did this come to be in the first place? Did you have founding a company on the bingo card many years ago? Give us a little bit of that backdrop of how this all came to be, those aha moments that turned into what is now Avalon Healthcare Solutions.
Thanks, Mike. And don't panic when I say I grew up in Arkansas, the son of a small town physician. I'm not going to take us all the way back, except to say this. I grew up around the healthcare system. I can remember being dropped off in the doctor's lounge as my dad went and rounded on patients. That's important because what I was really motivated by was the work he did and how could I make his job easier. I thought the way to do that was push back the boundaries of ignorance. So my first career was in research. I was very lucky to be coming out at the time that DNA sequencing and PCR were tools. But over time, I had experiences where ignorance of disease was not the rate limiting step on taking care of patients. It was the ability to afford it. I distinctly remember working in the county hospital in Houston and having to tell the family of a 6-year-old that they were going to have to return to Mexico because nobody would pay for their care here. And it really was a shocker to me to find out that in our country, affording healthcare was a big barrier. So I've spent most of my career on that. How do we afford healthcare? How do we make it more appropriate? How do we make the quality and the access better? And so 13 years ago, as I was coming off of a innovative run with CareCentrix, as you mentioned, I was looking around and I think everybody knows the science of lab testing was exploding. I think what most people don't know is that while genetics was exploding, every part of lab testing was exploding. Routine testing, the chemicals we can break down in your body, the antibodies we can put on cell surfaces, the stains we can put on tissues. And it's only 10% of medical spend, but 70% of decisions involve lab testing. And it just seemed to me, we can't wait the normal 20 years that it takes to get new science adopted. We have to accelerate that. So Avalon was founded to say, this science is important, getting the diagnosis right is critical, and we're going to work to get it adopted more quickly than the 20-year mark. And that's what motivated us to get going.
So let's talk about a little bit on a personal level, Bill. When you founded the company, where you're like, oh my gosh, what am I doing? I can't believe that I'm now the founder and CEO of a startup. What was that process like? Because we have a lot of aspiring entrepreneurs that tune in. What was it like founding that company a number of years ago?
You know, one of the weirdest feelings is sitting at your desk with a PowerPoint and you've got that. I was fortunate that I was able to put some of my money in and I was able to go meet some people and get some money committed if I could find customers. But how you take a PowerPoint and do something with it was a daunting task. I was very fortunate to have some co-founders, one of which had access to capital and one of which knew how to build companies from the ground up. And I'm fortunate in that I have been around the healthcare industry and know how health plans work and know how payments work and know how coverage works. So we just started running around the country meeting with people and having discussions. Here's the problem statement. Here's what we think of the solutions. And it took Mike 18 months to really start to vector in on what is a solution that could work. Because it's not, as I said earlier, it's not obvious in healthcare. The what can be obvious. What we want to solve is the science of lab testing is important. Let's get it deployed. The how is really complicated in our world. And so that took a long time to sort of start to vector in on just to get the first contract off the ground. And then quite frankly, one contract is one contract. The next 2 or 3, you have to adapt again. So when I think about it, the daunting task of sitting there with a PowerPoint was really a weird feeling. And then I thought the first customer, now we're off to the races. Nope, you got to reinvent almost for customer 2 and 3. It's really interesting how hard that is.
Very well said, Bill. Thank you for sharing that because it is incredibly important. That first one feels good, but that's just getting out of the blocks of a long race around the track, right? So let's talk a little bit today. Let's go current state, Bill. Who is Avalon Healthcare Solutions?
So we're a company that focuses on lab insights. And what does that mean? Very simply, we understand the science of lab testing, we understand who can do it, and we understand what you want to do with the results and what you ought to pay for it. If you think about COVID, it was a case study in how hard that is, right? People were wondering, what test should I do to see if I have COVID? Who can do that test? What do I do with the result? Do I stay home? Do I take medicine? And the health plans and payers and government were wondering, and what should we pay for it? Well, that's what we were doing for a living already. And that's what we still do today. We help solve all those problems. And it's harder than you think. We're lucky in US healthcare that many people are innovating new lab testing, as you saw in COVID, but that's not enough. Just because somebody knows how to run the test doesn't mean you can get access to it or the results used correctly. So that's really what we focus on. Overuse, underuse, and misuse, we try to stamp that out, basically.
Well, let's go there and let's talk a little bit about Avalon's Diagnostic Insights platform. It's combining evidence-based policies, curated laboratory networks, and real-time analytics into one integrated solution. Powerful in and of itself. Bill, can you walk us through how the platform actually changes the day-to-day experience for a health plan partner of yours from the moment a test is ordered to when a clinician decision gets made?
So the number one thing we first focus on is getting access to the right testing. And with a health plan, that means helping them update their coverage. Many health plans are behind on some newer tests and are still covering some obsolete tests. So we bring science to bear. We have a program that brings them electronic policies, gets them to adopt those as coverage, and we let them adapt and adopt those, meaning they can customize them to their needs. So while we bring the science, they may have to actually adapt to other constraints. It could be constraints in their state regulatory system, or it could be constraints in their provider networks. Once they do that, we then configure into our platform solution their coverage criteria so that we can automatically adjudicate questions of coverage either on the front end. So you might have complex clinical testing like expensive genetic testing in cancer where they may want that coverage decision before the test is ordered so the patient knows if it's covered, and we can do that. Or we can do it on the back end when they are adjudicating a claim. And we've got software packages that feather into their workflows. And so we basically take their coverage criteria and we take their workflows and integrate them into our system. And that gives them automated decisions on the front and the back end. And quite candidly, Mike, we improve the accuracy of that.
And you also mentioned patients. Let's go there for a moment as well, Bill. So, the more accurate diagnoses obviously are guiding the right care right from the start for patients. And so when we think about it from that lens, for the patients whose lives are directly affected by these types of decisions, what does it look like in practice when precision diagnostics are finally working in true alignment with their care pathways?
One of the things we finally have, Mike, is precision medicine. And I'm going to argue that we used that phrase too early in US healthcare. If you go back to about the time I started this company, that was a common phrase. Really, it was precision, diagnostics, as you said, where we would tell you, oh, gee, your cancer has this mutation in it. But we actually didn't have any new therapies to give you. We still gave you routine chemotherapy. And if I can do a quick sidebar on what that means, routine chemotherapy tends to kill any cell that's growing. And that's why your hair falls out and your immune system gets suppressed and the lining of your mouth, for instance, gets affected. What we're very fortunate now is that we have drugs that target some of those mutations in certain cancers. And one of our favorites to talk about at Avalon is non-small cell lung cancer. So non-small cell lung cancer is the kind of cancer you typically get if you're not a smoker. Unfortunately, it happens to be on the rise right now, and particularly even in younger people under 60. But that cancer, we now have a dozen plus drugs that target some of the most common mutations in that cancer. When you have that mutation and you get that treatment in a targeted fashion, kills only those cells. And that has two effects. A, it's more effective. And B, you don't get all the side effects. You don't go in the hospital with immune suppression. You don't have all these other, the emesis, the vomiting, and all the other complications. Tragically, though, a third of the patients with non-small cell lung cancer never get testing. So we've got programs to help promote access to that testing. And of the 2/3 that get testing, almost half get the wrong drug based on the results because they're complicated. So if you think about it, almost only a third of people are getting the best-in-class treatment right now. So for a patient, our programs help get access to testing so it's covered, but also help your doctor order the right test and then use that result to actually order the right drug. And we do that by feathering data and information around the healthcare system in an automated fashion so that it's actually real time, as you said earlier. So we're not sort of delaying access to care. We're actually trying to promote access to great care.
And also, let's talk about kind of the current state, right? Diagnostic science is evolving at a pace that can really be difficult for health systems and payers to even keep up with. I mean, it's true to diagnostic science. This is just true to just technology and innovation right now. It is moving at a breakneck speed. So when we think about this continual involving of the ecosystem in these types of science, how does Avalon help its partners accelerate the adoption of proven innovations, but without overwhelming their existing clinical administrative workflows?
It's a good question. And let's talk about what we're doing well. And then it'll point us a little bit to places we need to go. And that may let us sort of later tap into this community for help. But so what we've done really well is help get the right labs to the table, help get their tests covered, help get the doctors easier access to them, and help get the results moved around the system, like to the doctor and even to either the manufacturer or the PBM that's going to distribute the drug. And so that's really improving access and making it easier for the right thing to happen. I think where we believe we need to go next and where we aren't quite where we want to be is we need to be able to put this information kind of in the exam room when the doctor and the patient are together making decisions. And we kind of call that shift left in the care continuum, right? Let's move upstream. But to do that, I think you have to be very careful. Doctors have been, the EHR is touted as a great boon to the system, and I think it is. But if you talk to physicians, of which my wife is a physician, my dad's a physician, sometimes the EHR overwhelms them with too many flags and too many alerts. And I think if we become just another alert that gets ignored, I sort of think of it as forgive me, Apple, but I think of it like the Apple user agreement, right? It's now so long, nobody is going to bother to read it. The whole thing's white noise. You scroll as fast as you can to get to the bottom and you accept it. If we fall into that trap, then we haven't helped anybody. So we're really gingerly trying to tiptoe our way into the exam room in a way that what we share is actually of use to the doctor, not just more white noise. So we're great downstream. We're trying to get better at being in an exam room because I think some of the information we have would be most useful while they're making decisions with their patient.
Let's also talk the economics around all of this, right? It's obviously we're in a very difficult time right now as an industry kind of writ large. We're seeing, the gutting of Medicaid and just reimbursements. It's a tough environment right now. And so, Bill, from your perspective, health plans are often under enormous pressure to cut costs and more true than ever. And diagnostics can sometimes be viewed primarily as a, spending line to manage. So how do you and the team make the case to plan, for leadership, those smarter diagnostic investments that actually reduce the total cost of care rather than adding to it?
It's a great question. So look, affordability is the number one challenge in the U.S. healthcare today. When you've got $27,000 for a family of four as the premium, which Kaiser Family Foundation alludes to, that's an enormous amount of money. As you said, it's causing coverage to decrease. So now you've got fewer people actually insured even. That's always trouble. So how do we change it? Look, I think we all can agree fee-for-service medicine has had challenges. It promotes an incentive of access and do more, but it decreases an incentive of do the right thing first so that waste is reduced. So that's where we're coming in. We're trying to say, look, the best way to reduce waste is get to the right diagnosis first. And that's why you need to get the right diagnostics. As I said earlier, it's a small percentage of spend, but it controls 70% of decision making. So let's take that 10%, let's get control of the other 70 or 80%. And let's look across an episode of care, not just at unit cost within each silo. So if I go back to, for instance, the cancer work we were talking about earlier, you may drive up testing costs by having more genetic testing done on non-small cell lung cancer. And we may drive up therapeutic costs because some of these newer drugs that target mutations are more expensive. But we are driving down total costs because when you start on that right therapy and you don't have the complications of cell cycle inhibitors or routine chemo, you don't go to the hospital, you don't get admitted. So I think helping health plans and providers take that longer view that says, wait, a little investment up front on diagnostics, getting to the right therapeutic decision quickly, and lowering complications is a great way to drive improved outcomes. You'd love to attach that to value-based care. We've seen some inroads on that. We know the current administration is making some inroads, but we also know that when COVID blew up balance sheets for the providers, many of those hospital providers said, I don't care about value-based care. I need unit cost increase. And we sort of regressed, in my opinion, Mike. And so I think we're going to have to, as an industry, recapture a way to take an outcome-based approach to compensation ultimately and really try to get away from every widget has its own unit cost inside the system.
Very well said. Very well said, Bill. Thank you for that. Let's also talk about the impact you and the team are having. Avalon is supporting millions of members nationwide. So from your perspective, when you think about that measurable value your solutions are delivering across that type of scale, what outcomes are you and the team most proud of? And where do you still see the most room to grow?
So we are very fortunate. We're serving 30 health plans now and roughly about 100 million lives. And quite frankly, just as an aside, it boggles my mind when I think about sitting at that desk with a PowerPoint wondering how to get started. So number one, we're incredibly proud that we have both reduced a tremendous amount of waste, so save money, and improved a tremendous amount of access. We're proud that we're now moving into let's use the results to make sure the right decisions are being made. What we're particularly excited about where we're going, though, is we're now adding in diagnostic imaging as well. So the way we think about it is we're now really focused on get the diagnosis right. That's got both lab testing and it's got imaging. And when you add in some AI work on top of some of the reading of images, it's going to get even more complicated for people to understand how they should use it. So we believe we're well positioned to take our same ability to codify science and then get it covered, deployed, and the results used correctly. We think we can do that really well in radiology as well. So I think we're on our path with the 30 partners that we have and all the members we get to serve to really being the leader in, hey, how should I arrive at the right diagnosis for this patient? And doctors asking us that, the health plans asking to cover that, and the purveyors of that imaging and testing saying, and can I get paid accurately for that? I think we're really well positioned to keep leading that charge.
You mentioned partners, so let's go there. Obviously, Avalon is working closely with both health plans and providers, two stakeholders that, well, let's say they don't always see eye to eye. How do you and the team position Avalon as a trusted partner to both sides of that relationship simultaneously?
It is a challenge because we say, I've said for years in the industry, unfortunately, somebody's revenue is somebody else's expense, right? That's what sort of creates that dynamic. That's where I go back to science is a true north. I think if you stay wedded to the science, you say, look, let's all agree that we want to cover the science and we want to perform testing as the science indicates ought to be done. That's where I've been able to find common ground between the testing providers, the ordering providers, and the payers, starting with that science. Now, once you move into the money flow, now you are sometimes into more challenging times, but there's plenty of testing to be done. There's plenty of good results to be used, and there's plenty of waste to be stamped out to help fund some of the coverage. So we've found that if we can stamp out useless testing, that helps the health plan fund coverage of new testing. And if we get that new testing covered, that helps those providers who maybe had the useless testing removed feel better about their revenue. And honestly, doctors don't really have a desire to order useless testing. They're just not always able to keep up because they got a day job that's incredibly complicated and quite frankly, hectic. So I think that's how we're sort of finding a way through those three constituents. Enough waste stamped out to improve coverage, enough new coverage to help offset some revenue losses on the waste, and doctors wanting to do the right thing. Let's just make it easier.
Now let's grab that proverbial crystal ball off the shelf for a moment here, Bill. Obviously, we're in a moment, kind of an inflection point for diagnostics and healthcare. look as an expert looking ahead, where do you see Avalon and really the broader diagnostic intelligence space in the next 5 years? And what has to change at an industry level to fully realize that potential?
Well, so a few things. So one, the number of drugs that are in the pipeline that will rely on some level of precision diagnostics is enormous. We've only mentioned one cancer today. You've got pancreatic, colorectal, already have drugs that are there. There's other drugs in the pipeline on cancers. There's also drugs on the immune side. You may have even seen earlier this week some Alzheimer's related drugs coming down that look like in the bloodstream, we can actually start to get a sense of what's going on in your brain. So I think that's just going to keep exploding. And the demand for us to help people keep up with that science is a top priority for the next 5 years. I think secondly, if you think about the promise of AI, and sometimes a big buzzword, but it does have promise here. The ability to take data that will be a combination of lab results, claims data, and EHR information, and start to see where testing patterns actually drive outcomes we didn't know to think about. I think it's going to enhance our ability to contemplate value-based care and total cost of care, as we've been alluding to. And I think being an expert in the science will make us a very good partner for those entities that will be expert in AI to come to grips with those. And then thirdly, we're going to continue to have to feather through a regulatory environment that's going to struggle with, how do I give you a chance to do innovation, but how do I help you protect patient information in a world where computers are talking to each other and not people? And I think we're very good right now at knowing where to insert a doctor in the decision-making system, even though there's automation. So I think adopting the science, working with big data and AI, but also then helping the regulators be comfortable because we know how to keep the doctors and the people in the decision tree is going to be things that we do well over the next 5 years.
Very well said. Now, let's take it back to current state. Bill, we'll put that crystal ball back on the shelf for now. We'll bring it back to current state. And of course, we have an incredible community rallied around this podcast. What's one problem, need, or question that you and your team have that this community can be helping you with?
I alluded to it earlier. I would love advice on how best to get the insights we have on what testing ought to occur for a specific patient, how to get that into the exam room in a way that's useful to the doctor and the patient and not white noise. EHR providers, what's the best way to partner on that? They don't need me to be the expert in cancer. You've got other entities, but I happen to know what testing is covered by that plan in this case. How do I give that to them? So helping me shift left and provide value to the doctor and the patient in a way that's not white noise would be a tremendous help to us because I think we've got real value to create, but we need to do it thoughtfully.
And for the community members, I want to have that conversation with you. How do they find you online, social media handles, websites, or otherwise? How do they track you down, Bill?
I think I'm pretty easy on LinkedIn, Bill Kerr, MD. Website is avalonhcs.com. And my email is bill.kerr@avalonhcs.com. So I think all those are pretty easy to track me down.
Easy enough. And for our listening community, just scroll on down into the episode notes wherever you're accessing this podcast. Those contact points will be there for Bill and the team. Feel free to click on through to get a hold of him, or you can head over to our free global online community at passionatepioneers.com. There will be a post for Bill's episode where you can leave comments, feedback, suggestions, or otherwise, and find those contact points online. Again, over at passionatepioneers.com. Bill, what a wonderful conversation, but we still have a little bit more before we get you out of here so you can keep going and cause us that good trouble with you and the Avalon team. We have a fill in the blank for you. I'm a passionate pioneer because
we all deserve the chance to optimize our health. It's the only way you can buy time, Mike, is to optimize your health, and we all deserve the chance to do that.
Beautifully said, Bill. Beautifully said. Well, thank you so much for taking a moment out of your very busy day to be with our community and share everything that's happening in the Avalon camp. We're looking forward to continuing to follow the journey and see where we can be of help along the way. But for now, Bill, thanks again for being with us. We really appreciate all the time today.
Thank you, Mike. What a pleasure.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.